appreciate your time here, and I especially appreciate your leadership. I know this is not an easy job because I used to sit in that seat. I'm at Auburn University now, but for 16 years I served the city of Montevallo. I was on the city council and I was also the mayor for 8 of those years. So I understand how tough your role is. I can commiserate with you, I appreciate it. But we're here to share an opportunity that we're presenting to 10 different locations across Alabama to increase healthcare access. And you guys are in a very unique position because in your community you have incredible healthcare access. But we also understand it's limited in some of the more rural areas. And so Auburn University Rural Health Initiative was started to increase healthcare access in some of the most, the areas where they have the most limited access. So this is our web page. And so this tells a little bit about our mission here, that we do want to partner with communities. We received a grant to put 10 telehealth carts out in communities to increase access to primary care, to mental health, and also to substance use disorder treatment. The mental health treatment is on a sliding scale. Substance use disorder treatment is free of charge, and then the primary care would also be paid for by the individual's insurance. But these will be telehealth carts that we're able to place in different locations around the county. And so what we're here today to find out about is what your health priorities are, and then to find out, is there an ideal location in your county where you see they have a lack of access to health care? So if you look at under the locations tab, and I have my trusty assistant Shane here clicking. Let's see, it should, then now scroll down, if you don't mind. Okay, so these are all the counties. If you see these counties, we have telehealth stations in each of these counties, in West Alabama and in Chambers County. Some of you may have been there, but it's a telehealth station. This is not necessarily the model that we have right now for your community, but if you'll pull this interactive map here, what we've done is we have surveyed all of the communities that we're interested in working with to identify what current healthcare services they already have. So if you look on this map, this is where we are locating with the Rural Health Initiative. In West Alabama, we have these 4 counties. In East Alabama, we have these. Chambers County will have carts and a station. But if you want to enlarge Tallapoosa County and scroll over there, so what we've done is we have asked folks, and we've done a pretty broad internet search to find out where are your health services in your community. And this is what we came up with. Is this perfect? Probably not. But what we like to do is we like to find out where we might be able to locate a telehealth cart that can increase access to your community. But even before that, we're interested in what are your priorities and what are your needs in the community. So you all have these surveys out here. If you don't mind filling those out, then we find out what do you see as healthcare priorities and needs, and Shane can gather those, and then we'll have more data for you all. But I guess my question now is, as you look at all of these locations, do you see that there's anything missing terribly on here? Is there a clinic that you say, why don't you have that documented? And then I'd love to know from you all, do you have specific healthcare needs and priorities that you feel like we can work together on? This is not Auburn coming in and telling you what you need. We don't know. You know.
It's hard to discern what's way you're.
Well, I guess if you want to look just broadly, because I mean, in our city, obviously you have a lot, Dayville, you have a lot, New Site. Are there any other areas of the county where you think there's, we can drill down and Shane can share this map with all of you?
Joyce Robinson, we've identified like urgent cares, all the doctor's office, the basic services and all that. And so the east side of the county and the south side of the county tend to be those deserts. Daviston would be, I guess, the next third one up there where there's a need. There is no urgent care. There are no primary physicians. There are no clinics, things like that. We're heavily concentrated in Alexander City and Dayton. And then we do have urgent care now popped up in New Site, and you're served of, Reeltown is served by East Tallahassee area. But the initial conversations with Auburn University and Dr. Collins is the Campfield, the Reeltown area would be maybe the first priorities, because there is an island there where they have to go out of county or drive long distances. And as you've heard in other meetings, transportation is an issue
cart is literally in a rolling suitcase. You just pop it up and it has all of the instruments built into it. And we would be using East Alabama Health would be our primary care provider. So a small private room, ideally with dedicated internet in the building. And then we'd like to be somewhere that has staff. So, in some communities, one is in a library. Some of the libraries have spaces there. Maybe there's a vacated health clinic somewhere. Maybe there's a school that has access, that doesn't take students through it. But the other buildings we have an old school that we've used in, Bowlagee. We have there's a courthouse. We've looked at courthouses. We also have a municipal center in, that's one in Bowlagee. Vacated school that's actually in the city hall now. In Gainesville, it's in the city hall. And then in Akron, it's in the library. So we're getting really creative, but this is a model they're doing across the country. And actually, people across the country are looking at what we're doing now, as a model for what they can do.
Occupied school.
An occupied school, it would be, as long as we wanna make sure, obviously, safety is first priority, and what kind of insurance people would need to go in. And people are coming in sick, so we don't necessarily want people to come in sick past the students, but sometimes there's another insurance that folks can go in and they have other rooms in there. That's a really great suggestion.
Edwardville Tech School would be ideal, because the health services they're already teaching is a teaching lab, but having the general public come in definitely be a security issue.
Yeah, so Camp Hill City Hall might be ideal, but it is staffed and,
That's ideal.
yeah.
That's a great call on that.
And Dr. Costa, you remind them that the volunteers will be trained and all that to be able to operate the machinery and the technology as well.
So you mentioned the, rolling cart, and you mentioned the station. Now, the station, I know there's, I've seen, I think one of those stations at Tuskegee University, the Student
Yep.
Center.
Yep.
I've actually sat in one of those where you have, I think Kim Davis was there consulting on
Yeah.
theirs, and I actually went through the whole process with that, so that's what that is.
Yeah, that's the station, and we have these, now in 5 different locations in the state. Tuskegee has one, and we've talked about partnering with them, we're still in those discussions. But this is a much different model. This is actually no-cost healthcare for folks, but it's no cost to the patient, but it costs us about $500,000 a year to get one up and running. This is something that, there's funding out there, I'm constantly looking for funding, for these.
And I was gonna say, how much is your actual cost for that rolling unit,
Well, the rolling unit, it's about a $25,000 initial investment, but we've received a grant through USDA to purchase all of these for the community. So that's the cost. We don't have funds in there for staff, but we did get another small grant to do some training for some staff that, we would be able to, help to support there.
that's $25K to get up, I would think, other one's like $500,000 per year.
Per year. And this one's a $25 initial single one-time investment. But then there are expenses that could be, associated to the patient with some of the services.
And I guess I'm sorry for splitting here, is $500,000, is that for all year start, the whole program, or that half a million per station?
$500,000 per station per year. Yeah, it's a lot. But I'm gonna say, it's an incredible model, and this is new. We're just rolling this out with the telehealth cart now. And so, we're gonna compare the models, we're gonna compare the experience for the patients, and then determine, okay, this works very well. We feel good about what we're doing because of the high quality services we're getting. The mental health care will be provided through Auburn University Psychological Services. Substance use treatment will be provided by UAB Beacon, and then, as I said, primary care will be provided, by East Alabama Health. We haven't picked our first couple of sites for the cart rollout. Chambers County will be one, because we already have a really great location there. And then, we'd love for you guys to be our.
We're trying, we've been
Yeah.
working over a year.
Yeah, we have, and yeah, we actually went to a site not too long ago, but it didn't have staffing, and that's the thing. We need staff already there, we need internet already there, and we need a private space.
What kind of stuff?
Just somebody who is like a receptionist, an admin, someone, who can greet the person and who can be our point of contact. We don't expect this to be a lot of work for someone. If it gets to be too much, we can scale it back, we can look at funds for staffing. This helps to support.
Is there a mobile version of this?
Yeah, this is mobile. What we're talking about is mobile. There's not a mobile version of that.
Yeah,
Yeah, vehicle-based version.
right.
Oh, no, there's not,
talked about
but
that.
we can take these in a vehicle. I mean, this is, we can put these in a van, we can, but we actually do have, partial grant funding to get a mobile unit. We've secured about $250,000 maybe so far for a mobile unit. That mobile unit costs close to $5. We're getting there, I'm working hard.
Yeah, you could serve more communities.
Absolutely, and that's what we wanna do, but what we also have is, with the mobile unit, you have the vehicle itself, you have the telehealth itself, and then the people. And the people, that's that ongoing expense, so one of the things that we're doing in our communities is we're partnering with the community, I'm not here to ask you for money, I'm telling you that right now. But, yeah, which is what people usually love about me, but I'm bringing you money. But if we can partner with the communities, and if the communities want a mobile unit, that could be something that we could share the funding.
And I think there's room to expand based on our early discussion, if we could get another one.
Yeah.
Possibly for Highland Board, or in this case, you could go to Railtown or Capfield Davis and have designated days.
Yeah.
Being a mobile unit.
Yeah.
Demonstration they did to us about 1 month ago.
Yeah,
He literally took it to the airport security in a briefcase, in a suitcase.
yeah, I mean, it's really cool, you'd think it was just a suitcase.
Right.
So, oh, go ahead, I'm
Let
sorry.
me ask this question, so if a local government wanted to self-fund a unit or two, is that possible and then be added to your existing network?
Absolutely, I mean, anything's possible, and we love partnering, I mean, we're gonna be stronger together, but also if it's something that you just wanted to do and you needed any assistance getting something up and running, we'd be happy to help to support this. And anyway, just right now, we have we're ordering the equipment, Lori's in charge of all of that, and so that's what we're here to provide.
Any assistance from you to open the doors, to the facilities and locations would be appreciated.
Yeah, and that's really what we need to do. First of all, is this something that you want? Do you think that it would be helpful to you and your communities? And then what facilities do you think we need? And then the next step, once you all have an ideal location, is we would have a meeting like this with the community members, and it wouldn't be me talking at you, it would be us talking together to find out what your health priorities are. And then we also recruit ambassadors. I mean, if any folks in the community really wanna be ambassadors to help their neighbors to access these services, that's what's working really well in Chambers County. They have 44 ambassadors that even do line dancing and walking groups. I'm not a dancer, but it's really created this nice network and this culture of health.
So we could coordinate a visit somewhere to see this.
That'd be great, and I love burning up the road, I'll go anywhere, anytime. And so Shane, it would be the best point of contact, and we'll come out and check out the location, see if it looks ideal. But then again, we don't wanna put ourselves anywhere without talking to the community first, because it just builds up resentment. And we also wanna emphasize, we're not here to compete with any other healthcare providers. We want them to be a part of those meetings, and they may even eventually be able to be a part of providing the services in some of these more remote rural areas. And we're not trying to make anybody like this. This is just, my job is in outreach. I'm Assistant Vice President for Outreach and Public Service, and our literal job is to make connections between the university and the community to help make the world a better place. That's good. So I guess my only other question, and I know, I promise you I can keep it short, I'm not too short right now, but, is there a specific health priority that you guys have identified, in the community where you feel like there's a real need? Like, I was in Lowndes County and they were saying dialysis was huge. Well, we didn't have that capacity, but is there something in your rural areas where you feel like is a deficit or a gap or something that we can help to support?
One of our ongoing challenges is making sure there's adequate ambulance service countywide, and I'm sure you get that everywhere. Because
Absolutely.
we literally talk to the county commission association, that's an endemic issue around the state. So that's one. Two, just the fact that you have a survey may actually help us kind of identify a lot
happy.
much we don't know.
Yeah, we're happy to share that with you all. Actually, I have a QR code that we can leave strategically placed, a couple of them around, so more people in the community can fill these out. And, Extension, of course, is our best friend. Like, we couldn't do what we do.
Yeah.
We can put it on Facebook page today, to go ahead and start the survey and get input.
Yeah.
And I appreciate that question, it's great. And then the ambulance service, yeah, we've gotten that in many communities. I did also wanna mention that it's not just put the telehealth card out there, that we have faculty and students and, that are out in the communities as well, and they're doing screenings, health screenings and providing in services as well. So it's not just telehealth, it's hands-on that we can, get some folks out here. And we partner with other universities as well too. It's not just all Auburn, because I know some of y'all are gonna say roll tide as soon as I walk out the door. Okay?
Oh, we said it while you were talking.
Did you? Okay, thanks. You know what? I don't see them up here. No, we've actually partnered with the University of West Alabama and, the University of Alabama to do some things. So this is not just an Auburn thing, y'all. This is just a human Alabama thing. I mean, I'm born and bred here, and I really care a lot about our health, and we need to do better. I've got some stats, that I pulled here on all of the communities, and, actually, you guys are more in line with the state average than some of the communities as far as some of the healthcare needs, but our state average is much below the national average as far as areas of diabetes, obesity, hypertension is huge. I mean, people walk into some of these stations and they're in a hypertensive episode. We had to cart them in the ambulance, like straight from the station to the hospital, but we're just grateful they got the help. So I guess if you have any questions, we're around, Shane has our contacts, but the biggest thing is if you could just think about a good location, and we'd love to go visit, and we wanna get this, y'all wanna be first, we'd love for y'all to be first.
Try to be.
Yeah, I know, you're so good, no, y'all have a gem in Shane, I mean, you probably already know that. Somebody's like, you must be his brother.
We're best friends.
I knew it, yeah, I love it, I recognize that. We won't take up any more of your time unless anybody has a question.
Thank you for sharing.
All right, yeah, you bet, thanks so much. See, I didn't ask for money. That's pretty good, right? I like to be told yes. Thanks, Shane. Yeah, I appreciate it. And there, y'all do have an impact report, if y'all want to look at that, that shows what we've done over the last year.
All right, do we have any public comment from other officials?
I got that thing. I can get up there. As most of y'all know, March 15th, we had an EF3 tornado in Palace County. Thankfully, we didn't have any injuries. Actually, I don't know if anybody even had to get a Band-Aid for that, so that was great. I want to say a special thanks to all our first responders that responded to that incident, as well as all the road crews and the collaboration that was done with that as far as clearing roadways and getting debris up. Jackson Gap Mayor is here this morning. He was more than cordial to assist us, let us use his town hall for an incident command center, and even fed some of us for a couple of days there, so I really appreciate what he's done. The week leading up to that March 15th tornado, we had over 500 people signed up for the alert system.
this is that Middletown, Fire Department sponsored thing on May the 10th, and they do meet all the qualifications for ABC.
Make a motion to pass.
Second.
All in favor?
Aye.